Hey everybody, John Schumacher here with newwavehealthcare.com, and just want to give you guys a quick reminder that we are a video podcast. So if you're interested in consuming these interviews on video, in video format, go over to newwavehealthcare.com. We have over 30 video interviews there, included with all of our guests' resources and contact information. So if you like video like me, go over there, check it out. You can see us, you can feel us a whole lot more on video. So check us out there, newwavehealthcare.com. Also, don't forget to subscribe to our email list. We put out a weekly newsletter full of all kinds of awesome articles and content, as well as the replay from each week's interview there. So go ahead and get that right to your inbox. It's a good deal. You'll be happy you did. And one other announcement, we are launching a brand new show June 26th. Let me just look over here. Yep, June 26th at 5 p.m. Pacific, 8 p.m. Eastern. We'll be launching a brand new interactive Q&A style forum where my partner Michael and I are going to be talking about everything online marketing for healthcare professionals and entrepreneurs. Like I said, it'll be a live interactive show that you'll be able to ask questions with us. We'll be bringing on experts in the fields of online marketing to help all of you as healthcare entrepreneurs and healthcare professionals share your story and build an audience online, which I personally feel like is a major underutilized part of your marketing strategy. So just wanted to throw that out there. We'll have more information coming forth on that. So I think that's it for announcements. So let's jump into the interview today. Today my guest is Connor Dahlberg, who is the co-founder and I don't know if you're CEO or you're a co-founder at least of Speak2see, which is a company that provides a iOS application that's a communication tool to help individuals that are hard of hearing or deaf communicate better with healthcare professionals and their loved ones through the use of magnified text. So basically they can speak into the app, they can even type into the app and communicate via magnified text or pictures with loved ones and care providers. So it's a really neat app, and I was really attracted to it when I first saw it, so I thought I'd have Connor come on here and talk about his company, Speak2see, and also really dig into the entrepreneurial journey behind it and how he created it and some of the challenges and struggles that he went through to create his vision. So, Connor, thanks for coming on and chatting with us today. Let's just have you share a little bit about your personal background because we'd like to get to know you a little bit, and then we'll jump into your business.
Well, John, thank you for having me on the show. And so really my journey kind of started when I was young because my dad's been a physician for 30-plus years now. And so I started by going to the ER and staying overnight with him or going to his daily rounds at nursing homes and kind of always being really infatuated with the kind of technology that was going on to kind of do these like little tasks, such as like a heart monitor. And, there's all these little technology solutions that really just were kind of stood out to me as a kid, and I was always intrigued. And so I did that all the way through high school, just shadowing my dad, learning about healthcare. But the thing is that I kind of took a split. Instead of myself going to medical school as my dad did, I went to business school at Babson College. And so after my freshman year, I was really inspired. I came home. I was shadowing my dad again and doing some work at another hospital. And we were just talking, and it kind of came up that he just has this really difficult time, communicating with certain patients, and he doesn't know really how to fix it. He was using Google Translate for a while, but like the only way that was to work is he would enlarge the text and process, and it was a pain. And so we kind of sat down and we decided, like, how could we utilize what already exists to create a solution that would, create better care for these individuals and allow them to feel more comfortable in the healthcare setting, because they already, you're not comfortable when you're there, and especially older and dementia, whatever it may be. You want to make their experience as great as possible. And so that was kind of our goal from the very beginning, is to make people's experience better in the healthcare system and to also enrich, their ability to interact day to day.
Absolutely, yeah. So basically, like so many who are entrepreneurs or big creative thinkers, you saw a problem in the market space, and that problem was what inspired you to say, you know what, if someone's going to do something about this, why not me? Is that kind of what inspired you to start your company?
Yeah, so it was kind of like my dad and I were talking one night, and we both kind of just looked at each other, and I was like, I looked at him and I told him, the knowledge I've taken from Babson in my freshman year, as well as my own kind of, perseverance and loving business and kind of starting new things. We kind of sat there and we were like, we can actually do this. And so I started kind of putting together, a little bit of a business plan and some designs of, what we want. And then I set out on my journey, kind of finding, programmers and more technical people, because that's the one skill that I unfortunately didn't have. But I was able to kind of figure that out, and we kind of just started going with it and testing out some beta things. And he offered, a perfect testing ground with all of his friends as well. So we were able to get it in 6 different nursing homes in the Midwest area and kind of get great feedback from the beginning. And it's been, incredible. And we launched our full app, August 2013 on Apple, and it's available on the iPad and your iPhone as well.
Wow, yeah, yeah. So, how were you guys able to get in? You said you were in six different nursing homes, so you guys were able to test your product within those areas. How did you call them and just say, hey, I have a new product, would you test me, or did your father have relationships with those facilities already?
So my father luckily had relationships with those facilities, so it kind of gave us a perfect time to go in, because also we were doing it with patients that were already very comfortable with him, so it allowed us to really kind of test what improvement it would be making in that healthcare professional and patient interaction. And so that gave us some really great benchmarks on kind of what different designs we tinkered with and how they could really interact. And kind of the secret to everything that we're doing is that we do have the enlarged text, but the goal with everything that we're doing is we're breaking down these communication barriers. And so we created the MyList file system that basically allows a physician to go in, you have a new admission, and you have your list of questions you have to ask every single patient. And so that the ability to already have that pre-programmed allows you to kind of go through it at a more consistent rate, such as a real conversation, instead of it kind of being, a hassle, taking 1 to 2 minutes for each question to come through. We wanted to make it a more seamless process. And really what we're looking to do down the road is that we're looking to develop this MyList system to create more transparency for the healthcare facilities, such as nursing homes. Nurses can track the patient's activities better throughout the day, and then family members feel like they can also be more informed. And then another thing that comes into play is that states come in and get tagged with these big fees sometimes for very little things that you maybe didn't document. And we're trying to kind of recreate that and like take that problem away from the system by giving a very easy checklist and dialogue of day-to-day activities, so that patients can feel like they're more aware of what's going on, as well as the healthcare providers and as well as the families too, kind of creating a more of like a peace of mind at this point.
Okay. So it's kind of it solves, and let's jump into kind of the problems that Speak2see and your company and your app are solving. And I mean, it's not just a communication then tool, it's also a kind of a workflow type tool as well, you said, with lists and things that doctors can utilize to make their work more efficient. Can you touch on the main problems you guys are looking to squash?
Yeah, so one of the biggest things, if there's electronic medical records and there's, so many different systems that can be used right now. And we're not getting into that space by any means, but there's a lot of steps that get missed when documenting because there's so much paperwork. It becomes almost a nuisance. So something as simple as, doctor patient B or patient B, took their medicine at this time and then ate breakfast after. Something as simple as that allows the healthcare provider, such as the doctor and the nurse, to understand kind of the progress of the day. So if something were to go wrong, let's say at 3 o'clock in the afternoon, you kind of understand what happened before that, so you can deliver even better patient care after that sense. So it kind of creates a more seamless workflow. And then when I was touching on families, it allows them, because it's kind of a guilt trip at the end of it. You wish you could be there all the time, but you can't because you have to be away, but you'd like to know what's going on and without calling over and over again, because by calling over and over again, there's only so much time doctors and nurses have to give up because they have other patients to tend to. And by kind of creating this more transparent workflow of very kind of more broad information, but very important information, it creates a better, sense of mind for these families and for these patients, kind of understanding that they are being taken care of in the best regard, and their day-to-day activities are being monitored with the utmost care. And so that's kind of the workflow we're trying to kind of bridge some of those paper gaps at this point by using just sort of these simple lists and technological solutions.
Perfect. Yeah, yeah. So boil it down then for our listeners and our viewers today, and just let us know, if someone came up to you and you hit them with your elevator pitch, I guess you could call it that. What would that be for Speak2see?
So Speak2see is an iOS app that allows healthcare providers to communicate more effectively with their hard of hearing and deaf patients, allowing them to make them have a better sense of mind and create a better patient experience. And so that's kind of how I would sum up the current product right now. And then what I was touching on earlier is kind of some of the exciting developments we're hoping to have in the next 6 months. because we're actually hoping to add kind of a big technical team to our whole team right now, because it's just my dad and I. And so we're looking to kind of build ourselves out and give ourselves a real platform to create something. And
Right.
we're pretty excited about that.
Right. Very cool. Very cool. So you talked a little bit about growing up and seeing all of the different devices and around with your dad and everything like that. But did who had the aha moment? Like, what was your aha moment? Was it you and your dad that kind of sat down and said, "Look, this is a big problem. Let's do something about it"? Can you touch on like what was your aha moment? Like, we're gonna do this. Like, you could feel it inside you. Like, we're gonna go for it. That type of moment. Can you touch on that
Yeah,
moment and share that?
absolutely. And it's actually really funny because it was very much a team effort aha moment, which is kind of interesting because sometimes that's, not usually the case. It's kind of that single moment, but it was me listening to him, my dad, talk kind of about the problems he's having with certain patients and his inability to communicate effectively. And so what he had to do is he had to write on whiteboards, and unfortunately his handwriting is pretty terrible. And some doctors are at that fault as well, and so it makes it difficult. And then also there's odor that's involved that can upset the patients with expo markers, and it's not exactly an efficient process. And that's what he had to resort to before. And he was like, there's got to be a better way. And the way he kept talking about it, and he fidgets with his phone and he's trying all these different things, and I was messing around with Google Translate. We literally just sat there and I heard him, and I just like kind of stopped him for a second, and I was like, Dad, like, this is what we can do. It's very simple, but it's going to be very powerful at the end of the day. Our goal is to help people, and we can easily do that by magnifying the text immediately and creating an entire system around that communication system. And it was kind of it was kind of him going off on his problems, and then me like just kind of just sitting there thinking to myself like, oh wow, this is actually a really big problem, and we could make a great difference. And so that was it was like a team effort in our aha moment, and it was pretty awesome. We were just sitting at our dinner table and just talking, nothing too crazy, and we just kind of got on that topic. And then within a night, my dad and I stayed up really late working out all these plans and everything, because we just got very excited about the idea, and we followed through at the end, which is awesome. So when August 2013 rolled around, we were very excited to see the app get approved in the store and kind of go up for sale at this point.
That's really cool. Yeah, that's really neat. So look for problems, right? That's the key to coming up with things. Is people tend to shy away or kind of be annoyed by problems, but problems on the other end of the problem is always an opportunity. And you guys obviously saw that and took that action. And I remember the first night I was going to start this show, I was staying up and I was all excited, like I don't think anybody else is doing this right now. And you just kind of just start moving towards it, and you can feel
Yeah.
that enough excitement to where they're like, I'm going to do this. I'm going to really do this. And literally the next day you start taking action and start walking towards that journey. And so what were the first steps you guys took to get the ball rolling on your vision? And you're all excited and everything, but you had to translate that excitement into action. What were the first few steps you took?
So the first couple steps that we took after kind of our big night of excitement of kind of realizing this is a great idea and we really want to pursue it. The next day and kind of the next weeks preceding that, I really went out and I was fortunate enough to talk to a bunch of his friends that were also doctors, but in various fields. And then also I got to talk to some CEOs of some of the hospitals in our area, and I really got to understand what their core problems could be,
Mm.
and just asking them questions and really listening to what they had to say about what bothers them in the day-to-day, and kind of if there is a deaf individual that were to come into their place, how did they deal with it? They had to call a translator of some sort, and it took time. The patient got even more uncomfortable, and the experience just was kind of backwinding before they even had a chance to prove themselves. And so like I took a lot of that information in, and then I really started kind of writing down this plan of sorts to figure out really what are we trying to solve right now. And the simple thing was that interaction between the healthcare provider and the patient to make them feel comfortable again. We wanted them to have the best experience they could have. And so it was kind of learning from the administrators and kind of the heads of the hospitals to really learn what they felt was the issue. And so listening, and I took that, and my dad, I collaborated with him, and I asked him, like, can you ask your patients, like families, if this tool existed, would you use it? And so he did kind of a very basic Q&A with some of his families that were really known to him, and they said absolutely. And so obviously that was kind of people close to us, and so we kind of went even further than that. I went and kind of did some colder like surveys to kind of see what people's reaction would be just on a whim, and it was like just very surprising how excited everyone was. And then I also talked to a bunch of speech therapists who also were like, this is going to be a great tool, and they really like the whole picture and caption part, and that's something we really like to build up a little more and maybe add some video clips to it as well to make that process seamless for them. And so it was the immediate feedback that really gave us a lot, even more drive to finish. And so I kind of got to work with a programming company in our area, which at the time was Springfield, Missouri. And so we had an initial team working with us, and unfortunately we had to let them go, and that was a really tough process. I was second semester of my sophomore year, and so that was a pretty difficult thing for me to have to figure out how to go through. And luckily, I had great support going into that. And then we kind of went on, and we found Elevated Third, which is a company out of Denver, Colorado, and we immediately hit it off. They loved exactly what we were doing. They had great input, and they were really awesome to work with. So we met. I was in Boston, my dad was in Springfield, and they were in Denver, and so all coordinating and kind of having these meetings to bring it together, and test beta after beta was really a great experience, and that's kind of how it all came together in that process. And so it was very interesting, and Elevated Third really allowed us to kind of have the product we always wanted to launch.
Right, yeah. So you spent a significant amount of time interviewing your target market before you even made a prototype and started finding people to create the product. Is that correct?
Yeah. I really felt like I needed to understand the consumer, like the perception behind everything. So I had my data, but I wanted to know more.
Yeah. Right. Yeah, it's always a good idea to go out there and talk to your target market before you jump into things, because they may not have the same thoughts that you have, even though because you're all excited and emotional, and then when somebody else sees it as a neutral party, they might have some pointers that you kind of excitedly overlooked, or so not all ideas are great, so it's always good to validate at least the concept first, and then you took it to a developer, and then they didn't work out as well as you'd like.
Yeah.
I mean, can you touch on that? Because I'm sure that probably happens more often than we'd all like. Just a guess. Yeah. It didn't work out as well as you'd like. I mean, so you don't have to touch on like what happened necessarily, but just, I mean, how did you let them go, or what was that kind of like a little bit?
So it started with great promise. So I will put it that way. Our first initial meetings, I had met with a few other developers, and I just really wasn't that impressed with kind of how they were looking at the product. I wasn't into that. And we met with this one programmer, and he had some great ideas for it. Really, was really excited about getting started. And so, the first couple of weeks, 3-4 weeks into it, it was going great. He was sending us some demos of little pieces of what we talked about, and looks great, it doesn't look great, try to fix this here and there. But then what happened was that he started responding, a week at a time, and then it went to 2 weeks at a time, and basically just kept slipping and slipping and slipping, and deadline after deadline was getting missed, and I'm just thinking to myself, like, that's not, I mean, like, as much as I wanted to have it all work out, I was just in my mind, it's just that's not going to cut it, because we're trying to get this product out because we know people need it. And, taking this time, and if he's really going to be like this, that just means that he's not committed to the product. And so kind of the process of letting him go was finally we got, it was a couple weeks later after we emailed him, saying, hey, we need to talk. We had a very long phone conversation, explaining how, not meeting these deadlines, kind of dishonoring the contract that we had talked about, and going through it pretty methodically at that point. And, of course, he kind of rebanted everything, said, it's not true, I've been very busy, and, of course I could have taken that at the time, but in my mind I was just like, hey, I know you're very busy, but I'm busy as well, so is my dad, we're still making that time happen, and you promised your time, and just haven't been cutting it. And so unfortunately, it was just based off of that last meeting, we kind of had to end everything, deal with the transfer of all the information, code that already existed, and it was a bit of a mess. So we were kind of in limbo for 3 to 4 months there, and it was, it was pretty hard, but it was kind of a resilience on my dad and I's part, saying, we're not giving up on it no matter what. And finally, once we got everything, we got right back to it. And both of my older sisters actually live in Denver, Colorado, so they were able to introduce me to some people. And we met Elevated Third, and everything was clicking. And once again, though, I will say I took a step back very, very quickly to think to myself, like, this has happened before. So I did my research on the company, called some past people, and understood what they were like to work with. And so for me as an entrepreneur, that was a great experience, because now I know no matter what someone says on their website or says in person, you want to hear what other people have to say about working with them as well. And so that was one of the biggest lessons I took away from that.
That was great. Yeah, no, that's wonderful. I was going to just ask, what were some advice you'd give, but do your homework, right? Talk to past
Yeah,
customers when you're selecting technical help, because I don't know if the guy, I don't know the person, but I don't know if he probably was busy, but still that doesn't work for you. Your project needs to be a big enough priority in someone's schedule to keep it
yeah,
moving forward. So,
exactly.
I'm sure that was a challenge, but you know, you move forward.
Yeah.
So these guys, so the new guys that you hired helped you guys get a product, and then you were what? They developed it. You guys went back and forth for how long did it take to create?
So it probably took around 6 to 8 months.
Okay.
The 6 months is basically we had a really well-functioning beta version of it that we were testing with my dad and a few of his friends, and we were really kind of just getting the last kinks out. And then those last 2 months, kind of to the eight part, was kind of like touching up the design a little bit, making it a bit more crisp, kind of refurbishing the logo a little bit, and so kind of more of the appearance at that point. And so that was kind of the whole process, and we were meeting bi-monthly. They were showing us, new demos, and we were, talking about what we did and didn't want, and did and did like. And it was great to work with them because they met every single deadline. They missed maybe 2 meetings, but we also missed 2 meetings, so it was fine. Everyone had a reason for not,
Okay.
being around when they needed to, and so it was a much more improved experience, and they were very professional, and so I was very happy that it wasn't a repeat experience, and like I said, doing my homework, it's something that I'll never forget, and I've learned deeply at this point.
Great advice, definitely. You guys worked together, created the product, and then started beta testing it, and then you guys launched. You said it in October of
August,
2013, August
August, yeah.
of 2013, and did you guys know that people were actually going to pay for it? Because it's one thing to get people to say, yeah, that's great, I would use that, or that's great, yeah, that sounds awesome. But when it comes down to them pulling out their wallet and paying for a product and giving you guys revenue so you can scale your business and grow, that could be a different story sometimes, right? So
Yeah.
were you guys confident people would pay for it? How did you do that before you put it all the way on the market?
So we went back and forth on pricing of the app, kind of 199, 299, 399 type ideas, and then we really talked about it. And initially, we had priced it at the 199, and then we did the 399, and we weren't getting that many downloads, and so we had to really sit back and look at what we were trying to do again, and kind of revisit why we started everything. And the initial goal was to help people and to make a difference in the healthcare facility, and kind of improve the patient quality. And so what we decided to do is that I just finally made the decision that we should make the app free. And the reason I wanted to make it free was because without users, it doesn't become a valuable app. No one's going to know about it. And so that was kind of, to me, we'll figure out a revenue model later, and we have ideas for it. But without people that really like the product and really want to use it, we really don't have much. So we kind of made that decision in January to just make it free completely at that point. No cost or anything to anyone. And we've been averaging, great downloads, and we're a little over 7,000 downloads at this point. So, not the fastest growth I'd like to see, but still really steady and, consistent, and we're working on some exciting things to hopefully kind of really boost that. And it was another great learning experience, I did my homework and I understood, the market and everything, but I didn't also realize how difficult it would be to reach the market that I was going after, which were the physicians and some of these families of these hard of hearing and deaf individuals.
Sure.
And so that was a great experience. And then another thing that came out of it was that people that are very educated, and they do have some of the hearing problem, and they might be deaf as well, really responded well to it as well. We had a lot of users getting back to me and telling me how great the product was and how happy they were that we had created it. And we actually, there's a young guy, Leslie Ireland, that's in the Boston area that actually is just about to join our team. And he went to Northeastern, very well educated, and he suffers from hearing loss, but he's been able to give some really valuable insight, and I was lucky to kind of meet him across a few events, and he's going to really help us out in understanding how we can make it an even better product at this point. So the whole pricing thing was difficult to understand.
Right. Yeah, definitely. No. So you guys are doing, I don't know, a lot of these apps do like a freemium model where you can get an app for free, and then there's either in-app purchases, which I don't know if that'll work for your model, but upgrades or premium versions or things like that. So I'm sure you guys will figure that out. And
Yeah,
like you
we're
say.
definitely.
Yeah,
Sorry, right? We're toying with a few ideas at this point. So
definitely, definitely. Cool. So you got it on the market then, and you said you struggled a little bit with. Oh, looks like the cops are after you again there.
yeah.
Here in the background. These are live, everybody. So this is real stuff. Uh, I love it. Let's see. So how did you market it? I mean, how did you said you struggled a little bit with finding, where your market was and how to get downloads and get all these people interested in it. I mean, how did you guys spread the word?
So initially, it was on the merit of my dad's connections that he already knew, but it was really a lot of footwork that I was putting in since I was kind of back and forth between Denver, Springfield, and Boston. I was able to kind of I would just go walk and I would go to a few healthcare facilities a day, kind of throw some brochures I made down, hopefully get to talk to a few people and make some connections. And unfortunately, it was very slow moving doing that. It takes a lot of time and being in school, I didn't have all of the utmost time to put into it, which was unfortunate. And so we started also having a really good Twitter presence, which is really starting to pick up. And my dad and I have really been working on that together, and I've been teaching him, which has been kind of an interesting thing, teaching my dad how to use Twitter and kind of understand, how to tweet and how not to tweet, and who to tweet at. And so that was a great experience, and starting to pick up. It's definitely been kind of a marathon, but it's really starting to pay off. And that was kind of our social presence that we really wanted to focus on. And then when it came to marketing, it was just kind of, on the ground, making calls day in and day out type thing, just trying to figure out, who I needed to talk to, who wanted to see this product. And so right now we're going to start approaching some hearing loss associations across the United States and the different chapters. And, hopefully get involved with them and see, once again, get their feedback and how it can be a better product. And hopefully, they start using it and kind of marketing it for us. And that was kind of the goal too, as well, with making it free, is that we don't know the people that are downloading it necessarily, but if they're marketing it for us, it's something that maybe we're not touching on at the moment. And that was another really great reason. And since we did that, we've also seen a nice pickup in our downloads as well. And so it's kind of, in the beginning it was very slow, but we're starting to kind of figure out a good formula right now that's, really starting to work for us, which is exciting.
Yeah, sounds good. Sounds good. So what was the biggest challenge you guys? I mean, you guys have got a product on the market now. You're obviously still working on it and growing it and everything and figuring the few things out. But looking back on the past up to this point, you touched on some challenges, but in your mind, what was the biggest challenge you guys faced?
I think the biggest challenge that we faced was so my dad's expertise was in the medical field, and then I am like newly getting versed in kind of business and being an entrepreneur, and it's been really exciting. Now I have a couple of years on my belt, so I feel a lot more confident. But it was just such a massive like learning curve. But it was the want to do it that made us kind of push through all the information and stay up late nights to kind of figure it all out. So that was kind of the biggest hurdle, is just, putting ourselves in a situation where we actually didn't know, but we would, figure it out day in and day out, no matter like how we had to go about it. And so I would say that was one of the best experiences I had. And it's like, if you really want something, especially as an entrepreneur, you have that drive and that kind of that fire in you that no matter what stands in your way, you're going to learn how to build a website, you're going to learn how to write a business plan, you're going to learn all these different tools and kind of how to get your product noticed. And so it was
Yeah.
just the overall, kind of journey to where we are now, which is making a decision. Are we going to try to go after kind of a seed round, or are we going for trying to bring, more technical guys in the team, which is hopefully what we're nearing right now, which is very exciting for the development of the company, and, bringing it to Android and making it, across a few more devices would be wonderful.
Yeah, yeah, absolutely, yeah, yeah. And everybody, don't go get hung up on the technical stuff. I mean, you can find good people to work with you, right? I mean, it takes a little bit of juggling to find people that are fit your needs, but I mean, some people get flustered, or they don't know how to do this or that with the technical aspects of a business. But that's something you can outsource, and you can find good people. It's just no excuses really today to let that slow you down too much. It's people are out there. You can find people on Elance or Odesk or even Fiverr. I've used Fiverr several times and have found really good assistants, virtual assistants, stuff like that on there, and they work well. They put together projects pretty quickly, and there's just, I don't know how to do that stuff. I'm not like a Photoshop expert or anything like that, but I can get it done for not too bad of a cost. So there's really no excuses with that stuff anymore these days. It's a connected world. So
I completely agree, and that's we never were gonna let that slow us down. And so and also it's if you don't feel comfortable with like a decision you're about to make, or that's like a programmer, you're like, you think they're good enough, just good enough. You know, take a step back and understand that there's that one person, there's also 100 more people plus that can do the same thing, and you want to be comfortable with the decision that you're making.
Right.
Because you're already up every night thinking about how you're going to make things work and how you're going to do the next step. You know, you don't want to throw the extra pressure on yourself. Did I really make the right decision with that programmer? And it goes back to it, you know, you're building a team. You only build a team of 8 players around yourself that are going to make you a better, you know, leader or whatever position you may have in the company to kind of make it the best team as possible. Because once you start dropping the quality there, then you're kind of, you know, you're saying to yourself that you're okay with some lapses in some of your product deliveries or marketing campaigns, which is not what you want to do in the beginning at all.
Right. 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 So awesome, Connor. Well, I mean, I appreciate you coming on and sharing, you know, a bit about what your company does and certainly the journey behind it. It's always great for others who, you know, are aspiring to create a business and do something like that with the healthcare industry and any industry really. But it's great to hear the story and the process, and we appreciate you coming on. And let's just, as we wrap things up, have you give us one parting piece of advice, and then tell our viewers and listeners where they can find out more about you and your services, and then we'll say goodbye.
Well, one piece of advice I would have is that you're going to hear no, you're going to hear rejection, you're going to hear all of that, but that shouldn't matter to you, because if you have the belief of your product and what it stands for, then you're going to make it through. You're going to meet the right people, and so it's having the commitment to what you're doing and knowing that you love what you're doing. And you know, great entrepreneurs all over have said this before, but it couldn't be more true. When your heart's only half in it, and you're not going to fight through these brick walls that keep getting put in front of you. You're going to keep pushing through it. So you should never give up and never be turned down, you know, by a rejection. Only be kind of fueled by it at this point. So that's kind of my advice that I would give at this point.
Perfect.
And so, yeah, if you want to check more about Speak2see, www.speak2see.com, which is SPEAK with the number 2, and then CSEE, which you can find more information about the app. And then you can look me up on LinkedIn, Connor Dahlberg. I don't know if my name will be posted anywhere, but
Yep.
if you have that, look me up on LinkedIn. Reach out if you want to talk or connect. I'm always open, and I love talking about new ideas and kind of talking about healthcare, anything really at this point. I'm very excited about what we're doing, and technology is going to be a really important factor in moving forward with healthcare and kind of making it, bringing it to the modern age at this point.
Absolutely. All right, Connor. Well said, and thanks for your time today. And hope everybody enjoyed that conversation. I thought it was an excellent talk, and it touched on a lot of really important topics and factors along kind of the entrepreneurial journey there. So excellent stuff. If you are listening to this on iTunes or Stitcher, you can go to newwavehealthcare.com/speak, the number 2, and C, which is SEE. That's Speak2see. That'll be newwavehealthcare.com/speak2see, and you'll get the video recording here, and I will link up all of Connor's contact information and everything mentioned here, the website and everything. So if you're interested in his project or would like to reach out and just talk to him, feel free. I'll have that linked up there at newwavehealthcare.com/speak2see. And I think that's it for now. Like I said, be on the lookout for Health Jams, which will be launching June 26th at 5 p.m. Pacific, 8 p.m. Eastern. That'll be the online marketing forum for healthcare entrepreneurs. I'm excited about that because that is truly my passion is marketing and media and helping people share their message. So I can't wait for that. Hope you enjoyed this, and I'll see you guys on the next one.